Hello and welcome. Today we're going to talk about baby-led weaning and responsive feeding. And as you probably already know, because there's been a lot of talk about baby-led weaning, what you basically do is put a child in the high chair, provide them with the foods that you're eating, and let them just taste little bits of food. What I find in my experience is that does not provide the developmental training to be really good chewers. And a lot of the picky eaters that I see in my practice were failed baby-led weaners. Now, I think a lot of the theory behind baby-led weaning is wonderful. It follows Ellen Satter, who's a dietitian, who talks about the division of responsibility, which means that you as a parent, your job is to provide healthy, great-looking food for your children, and it's your child's responsibility to decide what she's going to eat or he's going to eat. Your parent's decision is when you're going to eat, like time by providing good routines, not rigid, but flexible, but also consistent, opportunities for feeding, and it's the child's responsibility to eat. Now, what can happen sometimes is that the child can gag a lot, they can choke, because their skill is not equal to or commensurate with what the complexity of that food requires you to do. And so I would like to offer responsive feeding. And what I like about that, and it's a kind of a new term, but in all the 35 years of my experience, I have followed the theories of responsive feeding, which is that you teach parents and they understand that a child's behavior is communication. So you're going to observe your child and see what they're trying to tell you, and then you respond to that communication. Now, the communication may not be words, I don't like this, I can't chew it, but their communication may be, I'm spitting it out because it doesn't work, or I'm having hard swallows, or I'm grimacing when I swallow, or I jut my head forward when I swallow. All of those are behaviors that are saying this food, I can't figure out how to chew it to a safe consistency. And by being a parent that's very responsive to your child's needs, you can use those techniques during spoon feeding. And if you've listened to any of my videos, you know that I feel that it's optimal and it's an advantage to train spoon feeding techniques, because think about everything that you eat. It turns into a puree. Now, it's not thick like your or thin like your yogurt puree, but if you look at your food, it's all chopped up and mashed up. It's like you put it in a blender. Your mouth, your teeth, your coordination of chewing is basically blending that food up with your digestive enzymes in your mouth and your saliva in preparation for that food to go down into your stomach and be processed and get the nutrients out of it. So by offering the spoon, if the baby turns their head, they don't want it, give them two choices. Do you want, bananas, mashed bananas? Do you want mashed avocados? They can pick whatever they want, and that is a great way to provide the baby with choices and to give them the power and the skills that they need to be successful, happy eaters. And that's really what our goal is, to have them eating healthy foods that you prepare, so you don't have to do short order cooking and only your baby eats this food and the family eats that food. That does not have to happen. You can blend everything to a consistency that's appropriate for the child, and as they get a bit older, then they're going to be able to eat what you're eating off the table because they're used to your flavors and textures, and that's a great way to develop healthy, happy eaters. I hope this is helpful. Thanks for your time. Have a great day.